Hello everyone. Today I am going to tell you how to immunize the high risk group of the children with pneumococcal vaccine. So we label the high risk or very high risk group of the children. High risk whenever child is having the normal immunity, immunocompetent child with chronic diseases, example diabetes mellitus, congenital heart disease, or having the chronic lung disease, or planning for the cochlear implant, we label as a high risk group of the children. They should be vaccinated with the pneumococcal vaccine. Now, the very high risk group of the children, if they are having the functional or anatomical asthenia, example in sickle cell disease, if child is having immunodeficiency, either primary or secondary immunodeficiency, example in HIV, or if the child is premature and very low birth weight, then also label as a very high risk group of the children. In them, we are supposed to give the pneumococcal vaccines. So, how to give according to the previous vaccination status as well as the age of the child. So, pneumococcal immunization in high risk group of the children, according to the age, we divide into three age groups. In less than 23 months age group, 2 to 6 years of age, and 6 to 18 years of age. In less than 2 years of age, if there is no previous vaccination with the pneumococcal, then we are supposed to give the vaccine as per the catch-up vaccination schedule, which is already explained in the previous video. So in 6 weeks to 6 month age, we have to give the total 4 doses, 3 primary plus 1 booster. Between 7 months to 11 months of age, we have to give total 3 doses, 2 primary plus 1 booster, 016. And between 12 to 23 months of age, we have to give 2 doses at 8 weeks interval. If child is between 2 to 6 years of the age and having the high risk category, then we have to see previous vaccination status. If child has already received the 3 or 4 pneumococcal conjugated vaccines, then we have to give pneumococcal polysaccharide vaccine 23. 2 doses we have to give. First dose after the 8 weeks of pneumococcal conjugated vaccine. We should keep the interval of 8 weeks. And second dose of pneumococcal polysaccharide vaccine we have to give after 5 years of age. If less than 3 doses of pneumococcal conjugated vaccine or 1 dose of pneumococcal polysaccharide vaccine received, then we have to give 2 pneumococcal conjugated vaccine also with 2 doses of pneumococcal polysaccharide vaccine. So 2 doses of PCV13 at 8 weeks interval we have to give. After that, 1 dose of PPSV 23 8 weeks after the last dose of pneumococcal conjugated, and second dose of PPSV 23 5 years after the first dose of PPSV 23. So this is similar to this PPSV 23 schedule, and we should keep in mind 8 weeks interval should be there whenever we are giving the second dose of pneumococcal vaccine. Now, if the child between 6 to 18 years of the age and no vaccine was received previously, then 1 dose of pneumococcal conjugated vaccine should be given, and after 8 weeks, 1 dose of PPSV 23 should be given, and after 5 years, second dose of PPSV 23 should be given. So, age group between 6 to 18 years, no vaccination schedule has followed previously, then we have to give the at least single dose of pneumococcal conjugated vaccine, and 2 doses of PPSV 23 should be given. An interval between the PCV 13 and PPSV 23 8 weeks, and second dose of PPSV 23 should be given after 5 years. And we know in healthy children after 5 years of age, pneumococcal conjugated vaccine should not be given, but they are the high risk group of the children. If 1 dose or more than 1 dose of PPSV 23 already received by the child and high risk group of the category, but no PCV 13 was received, Then we have to give the 1 plus 1, one dose of PCV13 plus one dose of pneumococcal polysaccharide vaccine. So one dose of PCV13 should be given 8 weeks after the last dose of PPSV 23 and one dose of PPSV 23 after the 5 years we have to give. So at least single dose of PCV13 required if child has not received any PCV13 here. If child has received the one PCV13, then two doses of PPSV23 should be given, one dose at that time and second dose after the 5 years of interval. So this is about the vaccination of high risk group of the children. Thank you so much.